Euthanasia. The word itself has a negative connotation. We hear it every day when dealing with pets or animals. But what about with people? Should euthanasia or physician-assisted suicide be legal? First of all, what is euthanasia? So euthanasia, according to a 2013 webpage titled Top 10 Pros and Cons of Euthanasia or Physician-Assisted Suicide, is an action of inducing gentle and easy death free of anxiety and pain. The euthanasiaprocon.org also points out that this is what the physician performs on the patient. The patient isn't actually doing this themselves. Physician-assisted suicide, on the other hand, as again pointed out by this webpage, is when a physician provides medications to a patient knowing that they want to end their life. So the physician is providing the means for them to commit suicide. Euthanasia then gets split up into 3 different categories. There is voluntary active euthanasia, which is when a clearly competent person makes a voluntary and enduring request to be helped to die. This is informed consent, pretty much. Passive euthanasia is basically letting somebody die. This is withdrawing or withholding treatment, like, for example, removing a person from a ventilator, from a feeding tube, etc. Non-voluntary euthanasia is when a person is incapable of making decisions or can't make his or her wishes known. So this is when people are in comas, or if it's a baby involved, or an extremely elderly person who is senile, mentally challenged, severely brain damaged, mentally disturbed, etc. They cannot make decisions for themselves. So if euthanasia was performed, it would be non-voluntary. So where exactly did this problem come about? Has there always been a debate about euthanasia in humans? What exactly is going on with it? Well, back in 5th century BC to the 1st century BC, the Hippocratic Oath actually wasn't followed. What that means is that they were performing euthanasia or physician-assisted suicide on a daily basis. After that, euthanasia quickly became opposed due to Christianity. The Bible actually states that to do harm unto another person is frowned upon, so euthanasia was obviously clearly a bad thing to do. This all continues on until about 1915, when a famous case happens. Dr. Hazelden allows a deformed baby to die rather than operate on it, performing passive euthanasia. This brought up the whole debate again, saying, should he have performed the surgery, should he not have performed the surgery? He had permission from the parents, etc. And then in the 1930s, the Great Depression happened. So public support obviously increased for euthanasia, as people didn't want to live during this time period. So people were ending their lives or getting physicians to help them end their lives, etc. So what are the reasons behind this? Like, why exactly is there a debate? I've decided to pick the top 4 pros and cons from that same webpage, the titled Top 10 Pros and Cons of Euthanasia or Physician-Assisted Suicide, and that is from the 2013 webpage from euthanasiaprocon.org. So the first reason is the right to die. What proponents of this are saying is that people should have the right to end intolerable suffering if they are terminally ill. The opponents of this are saying the right to die is not a fundamental liberty, and it is not protected by the Due Process Clause. What about if a patient is suffering at the end of life? Proponents are saying they shouldn't be forced to suffer. If they're suffering, they should be allowed to end their own misery if they feel that way. Opponents of this are saying that there's no way to put laws in place to prevent abuse of this and to protect people from dishonest doctors. Since there's no way to do this, why should we let people end their lives? Third reason, which I'm sure many of you were wondering when I'd get to, is the Hippocratic Oath and the prohibition of killing. Every doctor or physician takes the Hippocratic Oath, basically saying they're going to do everything in their power to help their patients receive the treatment that they need. The proponents of this are saying that in the oath it says to do no harm. Does not doing harm mean we should prolong a life filled with suffering? Isn't that essentially doing more harm? Opponents are saying that there is a promise of self-restraint in the Hippocratic Oath that all doctors and physicians should follow and should just treat them to the best of their ability. Lastly, and the most interesting, is the slippery slope to legalize murder. So what exactly is a slippery slope, and what is this about legalized murder? Well, in a 2011 journal titled Legalizing Euthanasia or Assisted Suicide, The Illusion of Safeguards and Controls, Volume 8, Number 2, Pereira, a Bachelor of Medicine and Surgery, declares that a slippery slope is when one exception to a law is followed by more exceptions until a point is reached that would have been originally unacceptable. And she then goes on to point out that euthanasia could be stopped as a last resort and could start becoming more of a first resort and could become more prevalent. People who support euthanasia are saying there's no evidence to show that this will actually happen. It's just all hearsay at this point. Opponents are saying this could be a halfway stop for other ways of direct euthanasia. Why need we ask for consent if terminating life all of a sudden becomes a clear benefit? So what can we do to help solve this problem? There are obviously two solutions to this. We can either legalize euthanasia or not. Well, there are 3 countries that have already legalized euthanasia: Belgium, Luxembourg, and the Netherlands. And they have set in place certain regulations to help make sure that this does not get out of hand. So of these regulations, what they have is they have voluntary written consent, mandatory reporting, only by physicians, and second opinion and consultation. So the voluntary written consent is pretty self-explanatory. It has to be voluntary. The person must provide explicit written consent. This is important to prevent abuse and misuse. Mandatory reporting is that they must report to the government every single euthanasia or physician-assisted suicide that they perform to ensure that their reasons are solid and sound. Only by physicians means just that. Nurses should not be the ones administering the medication to end life. It can only be done by a physician or a doctor. And the second opinion and consultation I found really interesting. This is basically when it requires consultation by a second physician to ensure that all criteria have been met before the euthanasia or the physician-assisted suicide is performed. And in Belgium, if it is a non-terminal illness, they need 3 physicians to review the case, and the physicians must all be objective and should not work together with each other, etc. If we don't allow euthanasia or the physician-assisted suicide and we do not legalize it, there are a couple things that we can do. We can increase palliative care. So what is palliative care? Well, according to Pereira, palliative care is medical care that relieves pain, symptoms, and stress caused by serious illnesses. This then leads into palliative sedation. So this is basically the monitored use of medications intended to induce a state of decreased or absent awareness to help relieve suffering of physical or psychological pain. So the goal of this is to basically, you're sedating your patients to achieve comfort at the lowest dose possible with the lowest level of sedation. We can also increase our hospice care, which is end-of-life care, elderly homes, etc. We can make sure that our elderly are getting the best help and treatment that they deserve. And lastly, we can better our mental institutions to decrease the amount of depression cases that occur. If people are no longer feeling as depressed as they were before, they're not going to feel like they want to end their lives. More and more each day, the suicidal thoughts should decrease. So after all that, what do you think? Should euthanasia or physician-assisted suicide be legal? This is not an answer that is going to come anytime soon.